Yes. All right. Good morning, good afternoon, good evening, depending on where and when you are watching this Facebook Live. This is the voice and the face of Dr. Olabintan, founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. And I'm here with the amazing Dr. Carolyn Moyers. And today we'll be talking about the phrase, Doc, my pelvis is not the same since I had a baby. Help me. Doc, how are you? And thank you for coming.
I'm well, thank you. It's a pleasure to be here. Thank you for having me. We are just down the street from each other, actually, because my practice is in Fort Worth, Texas.
Yes, and I'm supposed to. We're supposed to link up. 2 years. But we got to make that happen, but we will. But I'm so happy that you're very close by, and that's a good thing for our viewers too. So now, Doc, do me a favor. Kindly introduce yourself. Who are you, and what do you do?
Yeah, so I am Carolyn Moyers. I'm a board certified OB GYN, and I am a member of the North American Menopause Society. I'm a certified menopause provider. I'm a member of the International Society for the Study of Women's Sexual Health. But my secret sauce is treating back and pelvic pain in pregnancy and postpartum. I did a neuromusculoskeletal medicine fellowship, and I use osteopathic treatment to help women enjoy their pregnancy again, because we know that pregnancy pain is common, but that doesn't mean that it's normal.
I love all the things you do and all the things you're certified to do. This is awesome. Now, why do you do what you do? Is there a story as to why and how you narrow down to this niche that you have right now?
I don't know if we have time for that today. Yeah. I loved women's health. Going into medical school, I thought I was going to be a pediatrician. I loved
Mm.
women's health. I loved delivering babies. I loved women being proactive in their health care. So I just really followed my passion. After my first 5 years of practice, I thought there's got to be something more. I was constantly either disappointing myself or my patients or my family. And it's just
Mm.
been kind of a journey developing my skill set and the areas of gaps that I see in women's health. So some of my specific focuses are on treating back and pelvic pain in pregnancy,
Mm.
on menopause medicine, perimenopause, and then genitopelvic pain. We don't have a lot of solutions, and typical OB-GYN offices do not have time for these issues.
Okay. I love what you do because I feel like that's something that's not talked about a lot. I'm glad that you're an advocate for that, so women can also or empowered to take care of themselves and feel better even through every phase of their life.
Yes,
Awesome,
yes.
awesome, awesome. Now, can you explain how the pelvis changes after having a baby? For those who are watching who are like, "What's the big deal? I was fine before. Like, baby's out. Why? Like, what are the changes that happen that could explain some of the issues that occur?"
Yeah, well, first, like, what is the pelvic floor, right? I mean, you flex
Yes.
your bicep, but most of us don't have a good understanding of what the pelvic floor actually is. And it consists of this layer of muscles that stretch like a supportive hammock. Um, it's made up of a layer of muscles, ligaments, connective tissue, and the hammock goes from the pubic bone all the way back to the tailbone, right? And it really functions in vaginal intercourse, in bowel movements, and just holding all of our pelvic organs up. And whenever we go through pregnancy, we have increased pressure on our pelvic floor. And whether we birth that baby via C-section or by vaginal birth, you still could have urinary incontinence, fecal incontinence, pelvic organ prolapse, pelvic pressure, vaginismus, so pain because of hypertonicity of that pelvic floor and the muscles surrounding the vagina. So there are a lot of issues that can occur just from pregnancy and childbirth.
Wow. Pregnancy is still exciting. Just
Have a baby, they say.
it's like, oh my goodness, your body has to morph somewhat to
True.
address
It
the
is
baby.
absolutely a metamorphosis. Yes.
Now, what are the common changes that patients come to you about after having their baby? And I'm suspecting sometimes you have to tease it out of them.
Not really. Whenever they come to see me, it's pretty out in the open, right? Because either their OB GYN has sent them to me,
Okay.
or their pelvic floor physical therapist, or they heard from a friend, or they looked it up online. So typically they're seeking me out. So no, I'm not having to tease it out. It is interesting to find out sometimes that there was a previous injury that then pregnancy and childbirth has, kind of exacerbated. So that's one of the things I always like to look at. Was it, have they done gymnastics or have a history of scoliosis or horseback riding or motor vehicle accident, that could have kind of made matters worse. But typically I've seen an increase in pelvic pressure postpartum, and they swore they had prolapse, and we did a pelvic organ prolapse quantification score, that's kind of one of the nice things about having an OB-GYN who is interested in the pelvic floor, so that I can actually assess and say, truly, no, there's no evidence of pelvic organ prolapse. And with that, we prescribed pelvic floor physical therapy type rehab. And after 30 days of consistently doing the exercises, her symptoms had resolved and she was floored, right? So it's just a number of things. So it may be pelvic pain, it may be back pain, it may be sacroiliac pain, so that SI joint pain or sciatica pain. So those are some of the specific things in the realm of musculoskeletal medicine that I'm seeing.
Okay. Now, is it different C-section versus vaginal delivery? I know you had mentioned that earlier, but can we talk more about it? That, for someone who's saying, well, I had a C-section, or I'm planning to have a C-section versus doing a vaginal delivery, are the chances lowered one versus the other? I mean, C-section versus a vaginal delivery. What would you say to that?
I would say that some people feel like if they deliver via C-section, that they're going to avoid some of the trauma to the pelvic floor. And perhaps you might avoid some of the urinary incontinence and other things that potentially could go along, but we still can see, I mean, it really depends on the circumstance of your C-section, right? Because you may have gotten to 10 centimeters, you may have pushed for 2 hours, and you may have had an emergency C-section, or baby didn't descend and you still needed to go for a C-section. So your pelvic floor has been through very similar stress. So I would say no, in terms of, do women who've had a C-section versus a vaginal birth still need some amount of rehab in the postpartum period? 100%. 100%, because we've had an increase in pressure and increase in weight on that pelvic floor. And so, yes, I think everybody needs a pelvic floor PT in their life. I collaborate well with pelvic floor physical therapists. They're some of my favorite people. I think everybody needs it. And having somebody who can do an exam and kind of really assess what's going on, because I see a lot of pelvic pain and a lot of pain with intercourse. And just assessing what's going on. Is it the vulva that's having pain? Is it our outer genitalia that's painful? Or is it the pelvic floor muscles that are painful? And just being able to assess that. So, a lot of times my exam starts with a simple Q-tip, tiny little Q-tip, and we're just going to touch the vulva. We're going to touch those muscles with a finger and kind of identify exactly what is going on, because there's so many sources of pelvic pain, as I'm sure you're aware. It could be the uterus, it could be the ovaries, it could be a cyst, and it could be that pelvic floor. It could be the vulva.
Now, is it possible to prevent some of these things? Somebody might be wondering, like, whoa, is there something I could do before I'm planning to get pregnant? Any tips, doc? Like, what would you say to that?
I would say just physical activity and making sure that you're as physically fit as you can be, right? And as, I plan on asking God about the design of the female urethra. I mean, why is it so short and so apt to having some incontinence? But I think that it's really good to incorporate pelvic floor exercises into your everyday. And that does not mean that everybody needs Kegels. Because if you have a tight pelvic floor already, Kegels are a total disservice to you. You're going to worsen that and potentially have pain with intercourse. So, it's not always the answer. But incorporating some pelvic floor exercises into, keeping your core strong, your hips strong, and that pelvic floor, being able to relax it and to contract it is really important. And I think that's probably the best preventative medicine, as in addition to maintaining a healthy weight. Whenever we're doing heavy lifting, making sure we're using proper position, avoiding constipation, avoiding trauma to the pelvic floor, which, sometimes we cannot control. It really just depends on our history. But overall, I would say healthy weight, avoiding constipation, and good physical activity.
I love that. So I didn't ask you to say that. So diet, exercise, all those things do play a part. And so it's very important for a lot of things. And I like that you said Kegels is not an answer to everything. That's a good thing to know, because a lot of times, oh yeah, just Kegel, and you should be fine.
And most people don't even know if they're doing a Kegel correctly. Truly. Like, how do you know if this is Kegel? Am I doing it? I don't know. It's hard it's more of a conceptual thing for most individuals, because like I said, you can contract your bicep and you can see that contraction.
Right.
But
True.
how do I know I'm contracting my pelvic floor? And so that is a little bit of a trained skill.
Awesome. Man, I like what you do, and I'm glad that people have an option to come see you. Now, how soon someone's watching, like, yeah, doc, I understand these things. I will work on doing them before I get pregnant. While I'm pregnant, I will make sure to link up with an awesome doctor like you to help me through some of the issues that may come up. But how soon can one expect to get back to normal?
Yeah, normal is subjective, right? Typically, the pelvic floor will regain its strength in about 2 months postpartum. I really feel like that fourth trimester, so after baby to 12 weeks after, are really key for recovery. But if we're talking about incontinence, it may be a year on recovery with that. And so, whenever we look at some of the literature and we see the effects of, like improving urinary incontinence with pelvic floor physical therapy, oftentimes it's a significant improvement while they're doing the exercises with the pelvic floor physical therapist. The problem is follow-up, because we're like, oh, okay, it's better. And we get lazy about that follow-up, that maintenance exercise. And so it returns. And so I think that's really key, is that when you go to see a pelvic floor physical therapist, or when you work with somebody like me, these exercises are tools that you can use throughout your life to maintain a healthy pelvic floor.
Okay. My next question is a good segue to this, like long-term complications. Like, what are the common ones you see? We're talking years after the baby. And do you ever get to the point where you see patients who should have come to you sooner? Because that's
Sure.
that's key. So let's address the first one first. Long-term complications that you see, we're talking years after, and someone's like, okay, I finally got to see you. What are the most common ones you see that should have been brought to you sooner?
Well, I think, like with most things in women's health, a lot of times they're not addressed or talked about, or the patient feels embarrassed. So either the doctor's not asking about it, or the patient's not bringing it up, or a combination thereof. And so a lot of things that I see are like vulvar pain,
Okay.
that the patient has kind of been managing and telling her doctor what she needs, but she hasn't gotten any real answers. Pelvic pain or pain with intercourse. And pelvic organ prolapse and incontinence. Like, those are big ones that just kind of get avoided or swept under the rug, or they've seen 3 or 4 doctors before they land in my lap.
Okay. And just for those who are watching, a prolapse, when things fall out of place, essentially.
Yes.
Um,
The
yeah.
bladder or the rectum or the uterus even starts to descend out of the vagina.
Yeah.
So you get a bulging sensation or pelvic discomfort.
So for someone who's watching, Doc, who's saying, yes, a lot of these things apply to me. Yes, I've been embarrassed to talk about it. It's affected my relationship. It has affected intimacy. what would you say to them? Is there hope? Is there something that could
Oh,
change
there's
potentially?
so much that can be done. You just need to get in the right hands, the right provider, right? So, for significant prolapse, it may be that you need a urogynecologist. You may need a pelvic floor physical therapist for rehab, because a lot of times some of these things can improve with pelvic floor physical therapy. But it starts with just a proper exam and somebody being willing to point you in the right direction and help to collaborate your healthcare.
Awesome. Awesome. And that being said, Doc, people are watching you and they're saying, I like how you're able to explain things to me. I like that you're an advocate for things in this line because I've seen my OB-GYN, they just give me cream and say, see you later.
Yeah.
How can people find you?
Pretty easily. So we have a podcast. I host a podcast weekly called Sky Women. After the Chinese proverb, women hold up half the sky. And my practice is called Sky Women's Health. And so you can find us at skywomenshealth.com. You can find us on Instagram and Facebook. I'm the Pregnancy Pain Doc on Instagram as well. So we're all over the place on social, on our website, and our podcast, which streams live on all major platforms.
And your office. I know you have an office.
Yes, sorry. Yes, my office is in Fort Worth, Texas. We're in the heart of the medical district, off of Rosedale and Henderson. So you can easily find us, and you can find our address on our website.
Awesome. Awesome. And what I'll do is after this live, we'll have that information posted so people have access to this. But this has been very useful. What really resonated for me is that the fact that there's hope, people just have to speak up. And there are doctors like you who will address things like this and find the pain points and make sure they're addressed. You find them. So for those who are watching, of course, you can share this live with anyone who could find this useful. But this is good. This is good. Thank you so much for coming, Dr. Moyers. I know you're busy in post call, so I appreciate you for taking the time.
Yeah, absolutely. Thanks for including me. Happy to share with your audience.
Awesome, awesome. On that note, thank you all for watching. There's someone who's saying hi. I can't tell who this person is, but thank you for watching as well. And if you or anyone you know is looking for an awesome and a passionate and a thorough family physician in the Mansfield, Texas area, I am she. Thank you for watching and have a good one. All right.